Good morning from NCD in Copenhagen, Denmark. My name is Alison Ekberg, and it's my pleasure to welcome you to our launch today. We are now only 13 weeks from the 4th UN General Assembly high-level meeting on the prevention and control of non-communicable diseases and promotion of mental health and well-being. In anticipation of this important milestone, we've invited you to join us for the launch of a key report presenting new insights into non-communicable disease trends across the region. As member states and civil society prepare for the meeting, we're pleased to share a synthesis of the priorities you have identified, along with a brief summarizing our recent publication on the NCD quick buys. We hope you will find these products and today's discussion informative and useful. I'm delighted to be joined in the studio by Dr. Hans Kluge, Regional Director for WHO Europe. I will also be joined later by Dr. Gordon Galea, Strategic Advisor to the Regional Director on Non-Communicable Diseases and Innovation. Dr. Gundo Weiler, Director of the Division for Prevention and Health Promotion, and Dr. Ivo Rakovac, Regional Advisor for NCD Surveillance. But before we dive into the findings, I would like to hand the floor to Dr. Kluge for his opening remarks. Over to you.
Thank you. Dear colleagues and friends, good morning, good afternoon. What is the impact of failing to achieve our commitments to reduce the burden of non-communicable diseases? The report we are launching today provides an answer by shining a light on shortfalls and opportunities. The report offers a timely, data-driven assessment of where we stand, and the findings are sobering. Every year, 1 in 5 men and 1 in 10 women in our region die before the age of 70 due to cardiovascular disease, cancer, diabetes, or chronic respiratory conditions. Despite decades of progress, we face an alarming reality. Progress on reducing premature NCD mortality has stalled and in some cases reversed. For the first time, we are reporting on avoidable NCD mortality broken down into deaths that are preventable and those that are treatable. Every year, our region sees 1.8 million avoidable deaths from non-communicable diseases. 60% of them could be avoided through better public health measures, and the remaining 40% through effective treatment. This demands action now. The COVID-19 pandemic exposed vulnerabilities in health systems and demonstrated the consequences of neglecting NCD prevention and management. While we have seen declines in some risk factors, others, such as obesity and diabetes, are rising. Inequities persist between and within countries, and the annual economic cost of avoidable NCD deaths in the WHO European region now exceeds $500 billion. This report provides valuable insights for countries and stakeholders. In just 13 weeks, world leaders will gather for the 4th UN high-level meeting on NCDs and mental health to endorse a new political declaration. This is an opportunity to learn from the perma-crisis and craft a response that takes into account the rising megatrends. It is a time to renew political commitment, set achievable targets, and move from data to impact. There are no more excuses. We know what works. Here are just a few proven measures. Excise taxes on tobacco and alcohol. Advertising bans and restrictions on harmful products. Clear front-of-package labeling and food reformulation. HPV vaccination and early diagnosis programs for breast and cervical cancer. Treatment for hypertension. We need to build the healthy and safe environments and link NCDs prevention with environmental action. This is not just a matter of health, but of security and competitiveness. We need the bold leadership this September, followed by action in the coming years to turn the tide on NCDs, reduce the avoidable deaths, and deliver on our commitments and close the gap on years lived and years lived in good health. Thank you.
Thank you, Dr. Kluge, for that call to action and for highlighting the importance of data for impact. With that, let's turn to Dr. Ivo Rakovac to present an overview of the report's key findings. Ivo, first, congratulations on this publication. This is the first report on NCD trends to quantify the impact of the COVID-19 pandemic on premature mortality from NCDs. It also includes several new insights on avoidable mortality, as we just heard, on economic impact, and on inequalities. Ivo, over to you.
Thank you very much, Alison. So in the next 10 minutes, I have the privilege to show you the key results of the NCD Trends report. So as our regional director said, for the first time, we are reporting on avoidable mortality from non-communicable diseases. And we can split avoidable deaths into preventable and treatable mortality from NCDs. Avoidable mortality is a well-established construct that's reported by many national statistical offices and public health institutes, by Eurostat and OECD. But for the first time, we are looking only at the NCD-specific component. Just to give you an example, a preventable NCD cause of death would be lung cancer, because it is almost entirely linked to smoking and exposure to other risk factors. But once when you have it, the mortality is very high. An example of treatable death from non-communicable diseases would be breast cancer, although 30% of breast cancers can be attributed to risk factors like alcohol. 70% cannot. But if we have timely diagnosis and high-quality treatment, those deaths can be avoided. So you see here on the slide the gradient in distribution of preventable and treatable NCD deaths in our region. And we are seeing that we have 1.8 million avoidable deaths every year. And that those 1.8 million avoidable deaths cause almost more than $500 billion US dollars, cost of $500 billion US dollars every year. We also see that 60% of avoidable deaths are preventable, and we see that 40% of those deaths are avoidable. The key message is that prevention and treatment of NCD must go hand in hand. Addressing only one will cost life and will limit our success in the future. Another interesting finding from the report is that in a cluster of very high income countries, we have much wider variation in preventable mortality from NCDs compared to treatable mortality from NCDs. What this means is that probably healthcare systems are similarly effective in treatment, but there is wider variation in effectiveness of prevention policies. Let's turn now to premature mortality from NCDs. As our regional director said, currently every fifth man and every 10th woman in the WHO European region are dying before age of 70 from one of the 4 major NCDs. We also have 2.5 million premature deaths from NCDs, all NCDs, which is comparable to the total number of COVID deaths at any age over 4 years. We have the European Programme of Work target of 25% reduction between 2010 and 2025. And we have the European Action Plan target of 1/3 reduction between 2010 and 2023. And you see here the target line. You can also see that during the COVID pandemic, we went off track. The SDG target is much more ambitious than the European Action Plan. If we have a look at detail, we see that the COVID pandemic has derailed us from our on-track route, and that the progress in reducing premature mortality from NCDs stalled. If we look at the avoidable mortality, we see that before the pandemic, in the 10 years before the pandemic, both the preventable and the treatable mortality was decreasing by around 2% annually. However, with the onset of COVID pandemic, we saw an increase for both preventable and treatable deaths, but increase in treatable deaths was 3 times higher. It was particularly high for males. Also, countries with high NCD burden were more affected. If we look at the regional distribution of premature mortality from CVDs, we see large differences between East and West, with levels of premature mortality much higher in the eastern part of the region, for example, CIS countries. Those large differences between countries are mainly driven by male premature mortality and by mortality from cardiovascular diseases. You can see here how big the difference is between CIS countries and EU14 countries. And we know that we can tackle CVDs rapidly. Cancers are also very important, but here we have a slower rate of progress. So, in a nutshell, what are the key findings of the report in terms of progress towards targets? We are not on track for the premature mortality due to NCDs due to COVID-19 pandemic, basically. The pandemic brought us off track. We are on track for self-harm, suicide, and we are on track for alcohol as the only risk factor. All other risk factors are not on track. But however, we do see positive trends for all risk factors except for obesity and for diabetes, and no change in physical activity. For the first time, we are systematically reporting on inequalities between countries in NCDs and their risk factors, and we are seeing a decreasing trend in inequalities in mortality, but increasing trend for several risk factors. Let's turn now to policy implementation. We are measuring policy implementation with progress monitor indicators. Those are based on WHO Best Buy and offer an excellent return of investment. 1 for 7 in low and middle income countries and 1 to 10 in high income countries, which are majority of countries in our region. Briefly, on the right-hand side in the graph, you can see that we had substantial progress up to 2019 and the third UN high-level meeting. But then, after 2019, with the onset of COVID pandemic, we had only very, very limited progress. So basically, very little progress over the last 4 to 5 years. But there is hope. There is really a lot of hope. We are seeing that 10 countries listed here have achieved the European Programme of Work target ahead of the deadline, and 16 more are on track. So we ask ourselves, what are the distinctive characteristics of those 10 countries that have achieved the European Programme of Work target ahead of deadline? We looked at what is their rate of reduction from cardiovascular diseases, and we see that all of them have more than required 2% per year to achieve the target. We had a look what is their reduction of cancer mortality, and we again see all of them have more than 2% per year in reduction of cancer mortality. So to be successful, we need to tackle both cardiovascular diseases and cancers at the same time. It's not either or, it's both at the same time. Let's turn to preventable and treatable mortality. Very similar picture. We see that majority of countries are exceeding 2% per year in prevention. So prevention is extremely important. We also see that most countries are exceeding 2% per year for treatable mortality. So it's not prevention or treatment. It is prevention and treatment that we need to be successful. How have those 10 countries changed the levels of risk factors? We are seeing large reduction in tobacco use in those countries. We see substantial reduction in alcohol use in most of those countries. We see substantial reduction of insufficient physical activity in most of those countries. We see substantial reduction of raised blood pressure in most of those countries. And we see a limited increase in obesity. So it is not one or two risk factors. We need to tackle multiple risk factors at the same time. How have the countries achieved this? They have achieved this through implementation of comprehensive policies, as witnessed by Policy Score. So what are the key messages of the report? One, that the progress towards targets was derailed by the COVID pandemic. We have 1.8 million avoidable deaths, 60% of which are preventable. They cause $500 billion cost of productivity loss. Risk factors are on the decline, but the decline is not fast enough to meet most of the targets. Mortality inequalities are decreasing, but risk factors gaps are increasing. We need to set ambitious but achievable targets and strengthen data and monitoring. Comprehensive action should focus on both prevention and treatment. Addressing NCDs is key for competitiveness and resilience in our communities, and we need to act now. With bold action, the 2030 targets are still in reach. Thank you.
Thank you, Ivo, for sharing the highlights of this important analysis. Indeed, this is timely with the UN high-level meeting just 13 weeks away, as we have been telling you. Next, I would like to turn to Dr. Gaudin Galea and Dr. Gunda Weiler to reflect on the key messages and the themes emerging from both the analysis and our stakeholder engagement efforts. Today is actually Gaudin's last day with the regional office before he begins a new chapter and a well-deserved retirement. And Gunda will be taking forward the work of the special initiative in the form of a newly launched division on prevention and health promotion. I know both of you are in the midst of handover discussions, and I'd like to hear your reflections on the findings of this report and your thoughts on how we can not only sustain the momentum on NCDs, but increase it in the years to come.
Thank you, Alison. And yeah, indeed, I can't believe it is virtually your last day today. And we have spent a lot of time talking over the last couple of weeks for a handover. And of course, with regard to the current work, but I'm also trying to download as much as I can of your expertise, accruing from 30 years as a big name in public health and with regard to NCDs. And in those discussions, what resonated with me a lot is that there's always been this dual track approach. On the one hand, the important public health, technical work on NCDs, but on the other hand, also this, maybe I should say, struggle for attention for NCDs. So to put it on the agenda in a way that is appropriate. And one way to do so, of course, we are an evidence-based organization, is to talk about data, facts, and to make the case. And doing this, for instance, through this type of reports, the one that we are launching today. Now, there are many reports, and I wonder from your perspective, what's special about this one? We heard a lot of figures. What are maybe the two things that the audience should retain from this report today, and why?
So thank you for the kind words, both to you and Alison. I actually think this is a landmark report. It stands close to the UN high-level meeting, and we dearly hope that it will influence the discussions going there. If I were to think of two figures that people should keep in mind, it's 1.8 million avoidable deaths. These are, people seem to think of sometimes NCDs as this behemoth of unavoidable old age, chronic, degenerative disease. In reality, there are at least almost 2 million deaths that with present technology can be avoided. And their non-avoidance is causing $500 billion loss of productivity every year. So the human lives are important, and the impact on the society is equally important. And I think both of those should be used by our allies and advocates, NGOs, leading clinicians, professional associations, policymakers and politicians to work towards an acceleration towards SDG. Coronavirus, COVID has stalled progress, saturated the policy environment, and the ensuing polycrisis has made that worse, stalling progress. At the same time, we have good news on both these fronts. These are the messages that I think are highlights from the report.
I mean, these are really two important figures that are also new and that make the case for NCDs probably stronger than ever before, particularly for this region. I spent last months here to help coordinate the development of the new European Programme of Work for the next 5 years, the health agenda for the region. And we did so by having a broad consultation with governments, with member states, with civil society, with the population to find out what are really the issues that are on people's minds. And it's interesting, we identified 5 big issues, and 4 of them were issues that are originally societal issues. So we're talking about climate change, for instance, or aging populations, or security concerns, or we're talking about the next industrial revolution with the advent of AI. So these are societal issues that have an impact on health. But then there was one 5th issue that came out consistently, which is originally a health issue that has an impact on society, and that's NCDs and mental health. And this is not only because of the public health figures, but it's also a very personal issue. I think everybody knows someone in the family or in friends who's been affected by an NCD, who's maybe died prematurely. So the case is very clear. Now we still have this paradox that it's not translated into action and into investment. And maybe the one figure to retain there is the 2.5% of all health expenditure that is invested, only 2.5% for prevention, and vis-a-vis all the rest for other health services. So this is a paradox, and how can we overcome that? What's your view on this based on your experience?
You are very right. We should always be optimistic, and we should always look forward to new solutions as we try and achieve our public health aims. An important line of work that we have done recently is to overcome the misperception that somehow NCDs develop over decades and therefore can be prevented or reduced over the decades. I stand here, I often say that I am a cancer survivor. Just because there is treatment, I am still alive. Years have been added to my life. I'm very grateful to modern medicine for having done that. I'm one of that statistics of treatable mortality. So and this happened over a very short period of time. So like me, there are millions in Europe among those 2 million who die avoidably every year. So that's one area, to find the interventions that can work fast. And these we have published in March and in a paper called The Quick Buys for the Prevention and Control of Non-Communicable Diseases. And I think that is an important feeder into the race to the finish or at least to the finishing line on the Sustainable Development Goals and 2030. Another resistance to the investment is coming from corporate interests. There are many, but corporate interests, especially from the health-harming industries, hold back effective policies. So they often do so by frightening politicians and scaring them on the economic impact of certain regulations that we want to push forward, like taxation of tobacco, alcohol, and sugary drinks. That results in politicians holding back. We are exposing these efforts in publications like the Commercial Determinants of Non-Communicable Disease. And this has a longer term agenda. We need to be looking, this is not something to solve in a year or 2 or 5, but we need to take a generational view, a vision towards 2050 and beyond, of connecting NCDs with these larger societal forces.
Yeah, that's really interesting. So we have the clear-cut case, public health, but also personally. And now you say also we have the tools at our disposal, and maybe we can show this here. The audience, Alison has mentioned already that we are actually publishing, I think we have a nicer laid out version of this one. No, it's the other way around as well. We are publishing also this flyer that talks about this, we call it the quick buys, the interventions that have an immediate impact within a policy cycle and that are a subset of the broader set of interventions. So the case is there, the tools are there, still there's a hesitancy, and you have talked about also the other forces. There's also a pushback vis-a-vis implementing those quick buys that can generate also all the economic benefits. Now, what is interesting about this report is that it also talks, as Ivo has shared, about the countries who've actually done it. And we have the proof of concept that there are 10 countries who have ahead of time reduced premature mortality in the European region by 25%. 4 of them are on track for the SDGs. So we see it is possible in practice. And in none of those countries, governments were toppled because they reduced the NCDs. And we can be confident that a change is actually possible. Now, I see that time is flying, and I just want to look a little bit ahead as well. UN high-level meeting that was mentioned, 25 September. It's the 4th one. It's a really important event. And we know how powerful these high-level meetings can be. And I remember the first one, high-level meeting or special session on a health issue in the UN was actually organized in 2001, and that was on the theme of HIV. And that was a real game changer. At the time, countries came together, made a strong commitment to expanding, at the time, access to antiretroviral treatment, which was virtually non-existent. And in the wake of this event, the targets were developed, 3 million people by 2005, and also pursued. So they can be incredibly powerful. We hope the same applies to the upcoming 4th high-level event on NCDs. You've done a lot to prepare for that. And I wonder from your perspective, is it going to be such a game changer as well? What can we still do to make sure that we use it to the best possible way?
A deep but urgent reflection. We have only 13 weeks left, and what can be done? So I would like to frame it in a larger perspective. In WHO Europe, we declared a 100-week challenge as far back as October of 2023, reminding policymakers around Europe about the importance of getting ready for this. And over this period, a number of tools and guides and exchanges have been made in order to activate the professional communities, civil society, policymakers, in order to try and evoke a multi-sectoral response. All of these are important. And indeed, our colleagues in Geneva have organized meetings, for example, with the World Bank on financing. And all of this is fuel and adds to the evidence that can help us to accelerate action in the next 5 years. So already there is this body and this movement that has been working to counter possible complacency or forgetfulness that was induced by the COVID pandemic. And we are now feeling this resurgence of the movement. Countries can still impact the text of the political declaration. Negotiations are happening in New York. They're not happening led by health ministries, they are led by ministries of foreign affairs. So both the public and the professional associations, as well as all stakeholders, people with lived experience of non-communicable disease, etc., still have the possibility of influencing their policymakers who through the health attaches in New York can go for a stronger target-oriented, accountable declaration. It's not the be-all and end-all, but it is our responsibility to the European population, at least. We are talking in the WHO European region, to allow us to have a mandating document in the coming 5 years that will accelerate and help us achieve the mortality reductions that we so much hope for, and that this report urgently calls for.
Thank you. So yeah, we are looking forward to that, and not only keeping our fingers crossed, but still actively engaged. And I'm sure the audience will do the same to make sure that we get the best out of this very unique high-level meeting. So I think our time is up, Alison, and we have talked a lot more. We could talk a lot more. I'm sure people would love to follow this, and I hope you will use some of your time in retirement to write that book that puts it all down. And but now, actually talking about the high-level event is a gathering not of the UN, but of the member states and of the partners there at the center. And I think, Alison, now is about time to bring in some of our member states and partners in the discussion. So I'll hand it over to you.
Thank you. First, I want to thank you both. Thank you, Godin, for your leadership and your vision. Thank you, Gundo, for carrying this forward. So thank you very much. Now I would like to invite some of our virtual guests to join us. And it's my pleasure to first welcome Ms. Angela Paraschiv, Secretary of State at the Ministry of Health of Moldova. Secretary Paraschiv, the Republic of Moldova has made important strides in reducing salt intake, and most recently you've made changes in tobacco legislation. Both of these require engagement beyond the health sector and countering challenges from industry. How have you managed to work with other sectors to advance these policies?
Good afternoon. Thank you very much, first of all, for this opportunity to reflect on how the Republic of Moldova has approached two critical public health challenges, reducing salt intake and strengthening tobacco control by leveraging intersectoral collaboration as a strategic tool. In both areas, our experience has shown that sustainable change is possible when health policy is co-owned across government institutions and also society. We have to mention that in 2018, national data showed that the average salt consumption in Moldova was 10.8 grams per day, that exceeds a lot World Health Organization recommendations. So in response to this, we launched a national effort supported by the Healthy Life project, supported by Swiss cooperation, Swiss project, together with World Health Organization technical guidance. So key steps here included collaboration with the Ministry of Agriculture and food producers for food reformulation, also updated nutritional labeling standards via Standardization Institute and also Consumer Protection Agency, as well public education for local coalitions, schools also, and health professionals. We also carried out nationwide awareness campaigns such as Reduce Salt from Food, a multi-platform effort targeting families and food producers. Activities during World Salt Awareness Week organized in schools and markets, also nutrition counseling tools distributed to primary care providers. Also, we have to mention that in 2024, the government approved amendments to the decision that introducing limits on salt in different kinds of food, especially in bread, also sugar in packaging foods, and also concentration of saturated fats. These reforms were developed jointly with the Ministry of Health, Ministry of Agriculture, Education and Economy, ensuring a whole of government approach. One of the big challenges that we had and still have in the Republic of Moldova is tobacco control. And we have to mention that with over 6,000 tobacco attributable deaths annually, Moldova has intensified efforts to address both traditional and novel tobacco products. Here, I have to mention that in our legislation is not allowed to have any consultation with tobacco industry. So on this regard, we could modify our legislation and to extend smoke-free zones to outdoor areas, also to ban nicotine pouches, require toxicological reporting and safety standards for refillable e-cigarettes, prohibit advertising in all media formats, also increase penalties for sales to minors. Also, to support these reforms, we invested in targeted communication campaigns, which includes Choose Life, Not Tobacco, focusing on myth-busting around e-cigarettes and heated products. Also, the nationally recognized youth campaign, Don't Get Fooled by the Vapor, which engage adolescents through schools, social media and peer education, raising awareness of the manipulation behind the promotion of vaping and nicotine products. Also, television and digital content highlighting the health risk of novel products. Educational outreach in collaboration with youth, non-governmental organizations, school networks, and local authorities as well. The campaign Don't Get Fooled by the Vapor was particularly effective in reaching adolescents with age-appropriate relatable content, mobilizing peer-led dialogue in schools, and also encouraging young people to become advocates for a tobacco-free future. Also, Moldova's ability to advance these health policies has relied on strong national policy framework, including non-communicable disease prevention and control program that rely on 23-27 years, and also health strategy 2030. Also, cross-sectoral coordination mechanism encouraged in law and implemented with World Health Organization and donor support. Effective public awareness and social mobilization through professional communication and youth-oriented initiatives. So I have to mention that Moldova's experience shows that multi-sectoral governance, evidence-based policymaking, and strategic public communication can enable small countries to implement high-impact non-communicable diseases interventions. So thank you very much.
Well, thank you so much really for highlighting the importance of the multi-sectoral engagement, and appreciate and congratulations on your achievements there. Thank you for joining us. Thank you. And next, I would like to move from a country to a multi-country initiative, and I'd like to welcome Dr. Knut Inge Klepp, Scientific Coordinator from Joint Action Prevent NCD. Dr. Klepp, thank you for joining us. How can we scale up NCD prevention policies in the region, and how do we ensure that prevention and surveillance are prominently featured at the UN high-level meeting this September? Over to you.
Thank you very much, and thank you for the invitation. And first of all, I'd like to congratulate the whole WHO team with this important report. This is extremely useful information. I'd also like to take the opportunity to send warm greetings and a big thank you to Gordon on this very special occasion. So I think maybe the first part of the answer to your question is exactly what you are launching today. We need this kind of data, and we need to show progress, and also that there are countries that are able to achieve the ambitious goals that have been set. So for that reason, it is so important, the work that you are doing. And of course, for those of us working in primary prevention, it is very encouraging to see that as much as 60% of avoidable deaths related to NCD are preventable through reduced exposure to known risk factors. It is also really encouraging to see that there are leading countries that have achieved a 25% reduction in premature mortality, and particularly to see that these countries come from all corners of the WHO European region, because that, I think, really demonstrates that it is possible to achieve this goal for all countries when they have a concerted policy effort. So the joint action on prevention of cancer and other NCDs that I'm representing is made up of as many as 25 European countries. And the goal is really to collaborate, to learn from each other, share experience, and investigate how to scale up effective interventions and policies that are demonstrated to be effective and cost-effective. A large proportion of the funding from this project come from the European Commission, but substantial commitment and ambitions are expressed by the countries, both in terms of monetary resources and personnel that is invested in the collaboration. And I think this commitment from the countries is really important and something we need to capitalize on when we see how we can push these policies forward. Several of the participating member states in this joint action are among the 10 leading countries that have implemented comprehensive NCD policy packages. And by working together, so the joint action, we hope to be able to identify successful paths to having an impact. And we do focus on the shared risk factors for these different non-communicable diseases. And I think that is also an important point, that while there is a lot of focus on specific diseases, cancer, cardiovascular disease, diabetes, and particularly when it comes to screening and some of the more individual level interventions, it's important to have a focus on each disease. But we know that these diseases have a shared set of risk factors. So by focusing on these risk factors, we're able to have an impact on all of the diseases. And I think today, the question isn't so much how do we do it or what to do. It is more how do we actually do it. And here I think the work that WHO have done also in terms of the best buys and the quick buys is extremely important. So the work within the consortium, Joint Action Prevent NCD, ranges from best and promising practices, targeted population groups in vulnerable setting, addressing risk factors such as, for example, tobacco cessation, building local environments that promote active transportation, and addressing commercial determinants of health, including regulation of marketing of unhealthy products, and fiscal policies that promote healthy consumption. We also see that a lot of public health policy is formulated and has to be implemented at the local level. Other policy measures are at the national level, and are also important policy measures to implement it at the European level with the European Commission, for example. And we really need to look across these different settings and secure policy consistency. And I think that is one of the main challenges that we often see, that policies within different sectors kind of counter each other. So in order to succeed, we know we need to implement policies that reach large number of the population, including groups with less socioeconomic resources, and policies that have large impact on the population level.
Thank you
regarding
so much.
the expectations for the high-level meeting that you mentioned,
Yes.
I think it is really important that these policy measures addressing the whole population, such as fiscal and legislative measures, are being acknowledged and endorsed in the political declaration from the meeting.
Thank you so much, Dr. Klepp. And indeed, from local to national and across borders, this action is important in all settings. Next, I would like to welcome Deputy Venera Rambachayeva, Chairman of the Committee on Social Policy in the Parliament of the Kyrgyz Republic, and Deputy Chairperson of the Commonwealth of Independent States Permanent Commission on Social Policy and Human Rights. Dr. Rambachayeva, many thanks for joining us today and sharing your insights. How can the findings of this report support the work of parliamentarians, especially in the CIS, IPA? And what are your key priority actions for tackling NCDs? Over to you.
Мы вас не слышим.
Извините, пожалуйста. Уважаемые коллеги, представители ВОЗ и дорогие участники семинара, от имени парламента Кыргызской Республики и от себя лично хочу поприветствовать всех и пожелать успешной работы. Сегодняшнее событие — знаковый шаг в нашей общей работе по борьбе с неинфекционными заболеваниями. Запуск отчета по НИС в Европейском регионе ВОЗ — это не просто презентация данных, а возможность оценить достигнутый прогресс и определить ключевые направления для дальнейших действий. Неинфекционные заболевания остаются одной из самых серьезных угроз для общественного здоровья. Они влияют на экономику, демографию и общее благополучие населения. Согласно отчету, прогресс в снижении преждевременной смертности от неинфекционных заболеваний был нарушен во время пандемии COVID-19, в результате чего регион не достигнет целевого показателя сокращения на 25% к 2025 году. Тревожная ситуация наблюдается в восточной части региона. Особую озабоченность вызывает растущее неравенство между странами по уровню табакокурения, ожирения, гипертонии и диабета. При этом потребление алкоголя значительно сократилось, особенно в странах СНГ. Отчет подчеркивает необходимость ускорения межсекторальных мер, реализации подхода «все правительство, все общество», усиления профилактики и укрепления систем здравоохранения для преодоления этих вызовов. Ключевым партнером в этих усилиях выступает Межпарламентская ассамблея государств, участников СНГ. МПА СНГ выполняет важную функцию в законодательной гармонизации на пространстве Содружества, разрабатывая модельные законы, которые служат ориентиром для национального правотворчества. В сфере профилактики неинфекционных заболеваний МПА СНГ уже играет значимую роль, рассматривая к принятию модельные законы и рекомендации по контролю над табаком, снижению вредного потребления алкоголя, продвижению здорового питания и защите детей от вредного маркетинга. Документы, принимаемые Ассамблеей, становятся основой национальных стратегий и программ, а их реализация уже приносит ощутимые результаты. Снижается распространенность вредных привычек, укрепляется система здравоохранения, растет осведомленность населения. Наше партнерство с ВОЗ основано на общих целях и доказательных подходах. Совместно мы добиваемся того, что законодательные инициативы соответствовали лучшим международным практикам и глобальным рекомендациям. И вместе работаем над достижениями целей устойчивого развития. Отчет, который будет представлен сегодня, подтверждает, системная работа дает эффект, особенно при реализации научных, обоснованных, быстрых решений. Комплекс фискальных мер, акцизы на табак и алкоголь, нормативных ограничений, запрет рекламы, маркировка и информационных кампаний показывает результаты в снижении факторов риска. При этом работа ведется не только в области профилактики, но и в сфере лечения. Например, через повышение качества медицинской помощи при диабете в странах СНГ. Однако для достижения целей необходимо усилить профилактику, расширить охват населения и обеспечить устойчивое межсекторальное взаимодействие. Уверена, что благодаря нашей сплоченности, опоре на научные данные и совместным действиям мы сможем добиться еще больших результатов, больших успехов. Пусть этот отчет станет новым импульсом для решительных шагов на благо здоровья наших граждан. Сегодняшняя тема очень актуальна и очень важная. И я надеюсь, что мы придем к очень хорошим результатам. В только благодаря нашей сплоченности. Еще раз хочу поблагодарить всех, поприветствовать и поблагодарить за внимание. Спасибо большое.
Spasiba большое вам. Thank you very much, Deputy Rambachaeva. Next, I would like to welcome Marianne Taki, Acting Head of Unit from the Disease Prevention and Promotion of the European Commission. Given the Commission's commitment to NCD prevention through its work on cancer and soon cardiovascular diseases, as well as your leadership and coordinating role in the preparations for the UN high-level meeting, how are you making the case to keep NCDs high on the political agenda and policy agenda, especially in the context of constricting budgets and competing priorities? How do you see the role of prevention in supporting Europe's competitiveness and security? Over to you.
Good morning, and thank you very much. First of all, I would like to congratulate Ivo and his team on the very interesting, excellent report, which is also very timely, as this year is very important at the international scene on NCDs. Now, from the EU or Commission perspective, there are two key elements that can help us to move forward in the current challenging times when we all countries are facing limited budgets and competing priorities. And at the same time, we have important public health challenges and future challenges. First of all, we need more health promotion and disease prevention. And secondly, we need to find ways to use better the promising opportunities that are offered by digital technologies and the AI. Now, prevention and disease prevention and health promotion is the most cost-effective way of addressing the rising burden of NCDs. Investing in prevention is simply smart. However, we know that only about 3% of health spending in the EU is dedicated to prevention. The Commission has asked OECD to provide a new figure looking at the current data and information from the member states, and we hope to have a updated information on what is actually considered as health spending on disease prevention, and then we can also find better ways to support member states in defining new approaches to increase that number. One of the priorities of the new Commission, and especially our Commissioner Varheli, who is Commissioner for Health and Animal Welfare, is to improve preventive health. The focus is on cardiovascular health. This is in line with the political guidelines from President von der Leyen, and the Commission is currently developing an EU cardiovascular health plan. This is the start of our prevention approach, and it is the cornerstone of our comprehensive way of addressing prevention. The EU cardiovascular health plan is expected to address risk factors comprehensively, and I think many of the speakers have mentioned this, and Ivo already in his first presentation. It is important to look at risk factors across the board, and this also then indicates that we need to have multi-sectorial efforts. It's not enough if in one area we have wonderful results. We really need to work across the board and try to address several diseases and risk factors at the same time. Now, our efforts are not starting from scratch. We already have a strategic framework, the Healthier Together EU NCDs initiative, then that is really the framework in which we are supporting member states and stakeholders on disease prevention and risk factors. I was very pleased to see Knut from Norway to present the Joint Action Prevent NCD. The Commission is supporting that important initiative with the 76 million euros. It only started a year and a half ago, but it's already delivering important results. And the second important joint action on cardiovascular diseases and diabetes is led by Italy. It was launched in late 2023, and the Commission provides funding support with 53 million euros under the EU for Health program. So we hope that through these collaborative actions with the member states and also with the stakeholders, we will be able to build on important results, the cardiovascular health plan, but also a more comprehensive and sustainable way for prevention. Now, the second key area that I mentioned was the use of new and promising technologies, innovation, and ensuring patient-centered and personalized tools in prevention, in early detection and treatment and management of NCDs. Improving public health, it's important, of course, at the individual level, but the societal level is increasingly important. It is important that we have a way of communicating also on why prevention of diseases is so important and how we can bring together the interests of the industry, and I mean healthcare industry, as well as public health. We can help countries to boost research and innovation and support a business-friendly environment for health. And this, as a consequence, can help us drive economic growth and competitiveness in the EU. Now I would like to finalize by just mentioning that this year is very important year internationally and also in the EU for prevention of NCDs. And the European Commission is committed to work towards a strong United Nations General Assembly's political declaration on non-communicable diseases and mental health this year, where we hope that there will be a key role for health promotion and disease prevention. So thank you very much.
Thank you so much. Thank you very much. And you mentioned, again, the joint action NCD Prevent. We're also grateful to the collaboration with Jakardi, another joint action. You also highlighted the importance of multi-sectoral action. This is a theme that we continue to hear and we heard loudly from all of our stakeholders, and we'll come back to. So following on the issue of constrained budgets and financing, I would now like to turn to Dr. Sabine Vuc, policy analyst from the OECD. As countries face fiscal challenges and competing demands for investment in NCD prevention control can be deprioritized. Yet we know the cost of inaction on NCDs is significant. As we've heard, the cost of productivity loss is $500 billion every year across the region. From the OECD's perspective, how can we better make the case for long-term economic benefits of investing in NCD prevention?
Thank you. First off, my congratulations for the WHO team on this report. I think it has some very important messages that I hope many people will hear. One of the biggest challenges in public health is that our policies pay off, but this is often invisible because we prevent something from happening. When policymakers invest in advanced treatments or novel drugs, people notice this. But when prevention is done well, nothing happens. There's no illness, there's no crisis, but there's also no headlines. So this is just a hard sell politically. And I think that's why we need data. And that's what the OECD is focused on, in providing evidence to show that an investment now will pay off later. And that this will not pay off just in terms of health, but also in health expenditure, in the economic impact and wider well-being. So that's something we're actually working on now with support from the European Commission to show the impact that NCDs have on health, the economy, and wider societal well-being. Some of the figures in the report today show that we have been making progress on NCD risk factors. But the question, of course, is what's the overall impact of this? So the OECD has also been working with WHO Europe to translate these changes in risk factors into the impact that it has on health and the economy. We're still working on this, but I can share some initial results. When it comes to the NCD burden, what we're seeing is that our successes on reducing alcohol and smoking in many countries are actually being almost completely undermined by worsening obesity rates. So I think this is a very strong message for policymakers to understand. We're also showing what will be the impact of achieving the NCD risk factor targets, because of course we'll hear a lot about these on the UN high-level meeting. And what we're seeing is that if countries were to step up action on NCDs, GDP could be up to 1% higher in some countries by meeting these targets on NCD risk factors. So we're continuing working with the WHO Europe on this work. We hope to have it ready for the UN high-level meeting, both to celebrate our achievements that we have made, but also to recommit to the NCD targets and step up action on NCD risk factors. Thank you.
Thank you so much. And again, I think what everyone is showing is how much work this takes between all of us as well, between all the organizations. And we are so grateful to all of the collaboration. Now I would like to bring in Carolyn Costangs, Director of EuroHealthNet. Thank you for joining us today. As a public health expert with a focus on inequities and social determinants of health, what do you think is needed to reduce inequities and improve NCD outcomes, especially as we move closer to the 2030 SDG deadline?
Yeah, thanks a lot, Alison. So EuroHealthNet really welcomes this very important report. It's very good to see that some progress is made towards the targets in the high-level UNGA meeting on NCDs. And indeed, we see that inequalities in premature mortality between countries are reducing. We also know this in the analysis that we are currently doing of the European Social Survey, which is mostly due to the fact that in Eastern European countries, the decline has been much faster than in some of the Western European countries. So I would say that in a way we see at the European level an upwards convergence, because there was more health gain possible also in Eastern European countries. So I think that's positive. But it is very important to look at inequalities within the countries, because inequalities in premature mortality of NCDs between socioeconomic groups is still very wide and is increasing in some countries. In a way, we also see a clear social gradient across different educational groups or employment groups in the risk factors, such as obesity, alcohol, tobacco, due to the very root causes of health and NCDs, and we all know what they are. So if we want to accelerate progress towards 2030, we really have to acknowledge that we can't improve NCD outcomes without tackling these root causes, without addressing the social injustice that people are facing, the inequalities in wealth, inequalities in power. That's really, really important. And also, we need to be sensitive for this lifestyle drift in health promotion, so that we are not promoting lifestyle interventions to the individual level and then also holding them responsible for it and blaming if they don't act. We really need those structural upstream changes indeed. So I welcome very much from the European Commission the development of the cardiovascular health plan, but I am a bit concerned with bringing in also the digital technology and so on, that there will be a too strong focus on personalized prevention rather than addressing the upstream measures and the societal approach in a way, as Marianne Taki was referring to. Because we do need these population measures like regulations, the legislative proposals on alcohol, tobacco, food, and really address these commercial terms of health. Civil society organizations really have a very important role to play here. It's unfortunate to see at the EU level that civil society organizations are under threat, financially also more difficult to act. And this is, I think, certainly something for WHO and member states to be aware of. Lastly, as we heard from Ivo also, that the obesity rates are not improving, so we need to put much more attention on food. The food that is mostly available and accessible and affordable has become more and more unhealthy, and that is partly due to the big influence of the food companies. And I think we need to protect people much better from these market forces in order to make sure that they can access and afford healthy food, and that helps them to live healthy lives. So let me, on behalf of the EuroHealthNet partnership of more than 80 organizations, thank wholeheartedly Gauden Galea for all his work for the NCD community. And I would really like to wish him a very happy retirement as well. Thank you.
Thank you so much. And thank you for bringing it back to the upstream interventions and to the policies and building the healthy environments. So I just wanted to bring attention back to the other publications that will be posted today on the website, and that's the 25 quick buys. Again, the policies that can have impact, measurable impact in less than 5 years. And also the Building Bridges for United Action on Non-Communicable Diseases. This is a synthesis of over 1,200 inputs from across the region about priorities, again, stressing the importance of multi-sectoral action, collaboration, data for impact, and addressing commercial determinants and influence of industry, and many more. So please, you will find links to these in our chat, and we will be sending them out after the session. So with that, I would like to give the floor back to Gundo and Gauden for closing remarks. Over to you.
Gauden, please go first.
It's at the same time a call to action, at the same time a celebration. It's a call to action because the pandemic slowed us, but we can see the strength of the movement. We can see 10 countries have got there, 16 hot on their heels. We have a recipe for success. We have a challenge for accelerating action, and we have a UN high-level meeting ahead of us. I think let us use this moment to celebrate the dedication of so many workers and the successes of the countries that have reached the line. But there is no room for complacency. Indeed, the lack of further investment and action is actually becoming an issue of social justice that we desperately need to go forward. Thank you to all who worked on the report, and thank you for all the good wishes as well that were expressed on a personal level. Over to you, Gundo.
Thanks,
and I hand over
yes.
to my really close friend, Gundo Weiler, whom I have great expectations and friendship for.
Thank
Please.
you. Thank you. I will do my best. No, it was great to hear from you, and also particularly from our partners and from countries. And you've basically summarized it. But if there are 3 things that I take away from that discussion, first of all, we are talking numbers, of course, and the numbers clearly show that the case has never been stronger than before, and also the additional information that we are getting through this report. But of course, numbers is a tricky issue. We always need to remember that behind each number there is a personal life, and there are families, there are mothers, fathers, brothers, sisters, friends affected. And I think that is what drives, what has driven you all the time, and that is driving all of us to step up even further as we go ahead. The second theme that really resonated with me is that in NCD prevention in particular, from a health sector perspective, it's one of the cases where we say the health sector is owning the problem, but not the solution, because a lot of the solutions lie outside of the health sector. And we really, as a health sector, have a responsibility to reach out and to stimulate that whole of government approach. And of course, the high-level meeting is a whole of government meeting at the senior level, and we've got high hopes that this will be supportive in that way. And I think the first message to end also a little bit on a positive note is that, as you've said, prevention works. Has been shown. We've got 10 countries who've done it. 16, as you've said, are going to achieve their targets in the European region. So there's also a real reason for us to step up and to make sure that what has worked in 10 countries is going to work in all the other countries as well. So the high-level meeting is a real important moment for that. Looking forward to this, and thank you for sharing your perspectives.
Well, thank you both. Thank you to everyone who's been involved. Thank you to everyone who joined us online today, and to everyone behind the scenes, to our translators, to everyone who's really put this together. I, again, want to thank you, Gauden, for spending your last day with us in the studio. We wish you the best.
It's the last day with WHO.
Your last day with WHO is with us in the studio. We wish you the best. And again, we just have a great day, a wonderful weekend, and enjoy the next chapter, Gordon. It's been an honor to work with you. Thank you for your vision and leadership. And thank you to everyone who joined us.